Hi, my name is Michael Morgan, and I'd like to speak with you today about the craniosacral and geriatrics course. How this course got created is I had a stepmother with Alzheimer's who lived in an Alzheimer's unit in California, and I had a sister-in-law who also succumbed to symptoms of the disease. And I started to think, having taught craniosacral therapy for a number of years, what could we do with the craniosacral techniques to help people with this condition? Dr. Upledger, my mentor and trainer who developed the Upledger craniosacral therapy years ago, wrote an article, and he said several years ago that cerebral spinal fluid in normal adults was about 800 milliliters a day, and with people that were aging it was about half as much. One of my researchers at the University of Iowa did further research and found out that people with Alzheimer's and dementia, the fluid flow was even less than that, or about 200 milliliters a day. So that's the difference between 200 milliliters a day fluid flow and 800 in a normal adult. Now, why is this important? Well, cerebral spinal fluid has a chelating action. It removes heavy metals across the blood-brain barrier, and it prevents immune system factors from becoming compromised inside the brain. What happens if there's a lack of fluid flow in the brain is it's an opportunistic situation that creates an inflammatory response in the brain. And the consequence over time is that the brain will create what are called plaques, amyloid plaques and tangles, which are found in people with Alzheimer's. So part of what our research was when we did some scientific research on this a few years ago was to take a pilot group and do a simple craniosacral technique called a still point once a day for 6 weeks for about 5 to 10 minutes. And we found we actually had clinical and statistical change, where people started getting better. And we realized if we could do this in a small group, and this was a study published in the American Journal of Gerontological Nursing in 2008, that how could we actually help people that were prone towards Alzheimer's, that were at risk, or even in people in earlier advanced stage. And out of this, we created the craniosacral therapy and geriatrics course. It's a simple 2-day course which teaches lay people and healthcare practitioners how to do this technique in a 2-day training course, and then they can go back and treat their loved ones, people in nursing homes, people in independent living. And it's so simple that basically even someone with without any training can learn how to do this. So this coming fall, we're actually rolling out this course, teaching it in Southern California in September, and then in October also in Canada and in Iowa, and begin to train practitioners, whether they have training or not, in how to use this technique. We feel that we can prevent, first of all, prevention is key, Alzheimer's from getting to the stage where inflammatory responses build up in the body and create further problems. Secondly, with people with early onset Alzheimer's, we feel that we can prevent the disease from going from one stage to the next. Thirdly, with people from immediate to moderate to severe Alzheimer's, we feel that we might even be able to, again, stay the progression of the disease, perhaps even reverse the process. So we'd like to invite you to take a look at our website, bodyenergy.net, find out more about this training, and we feel we can make a positive impact on this population. Thank you.